Thank you very much. I didn't have my translation headphones on at the time, so I assumed that everything that was said about me was nice and polite and correct. I just wanted to sort of, just on a personal note, that Odessa is quite a special place for me, and this is quite a special day. It's a special place because sometime at the end of the 19th century, my great-grandparents fled from Russia because of Tsarist pogroms from Kiev and from a little village somewhere in the area, I don't know where, and they had to leave Russia through Odessa. They had to get on the boat and they came to Britain. The other reason why this is an important day for me is because exactly a year ago my mother died, and she was really the kind of, she was 95 and she was kind of the last of her generation that could tell anyone about coming from Odessa, and she heard it all from her parents. So yeah, I'm very glad to be here and very glad for the invitation. So what I'm going to talk about is this report, which I've authored and edited over the last few months, called No Smoke Without Fire. And it's really one of the first attempts to bring together all the data and all the information about tobacco harm reduction as it relates to safer nicotine products, which is e-cigarettes, which is heat-not-burn devices, and Swedish-style snus. What it does is it looks at all the products, it looks at the consumers of these products globally, it looks at the science and the clinical evidence about the relative safety of these products as compared to cigarettes. And it's important to make that point. We are talking about harm reduction here, we're not talking about harm elimination. But the point is that these products are so dramatically safer than cigarettes by a considerable margin that the term relative is important, but they are significantly relatively safer. The report also talks about regulation and control, the global landscape of regulation and control of these products. But really the core of this report is not so much about the products or the science, it's all about harm reduction as it relates to human rights. So I'm sure you're all familiar with the term harm reduction, but harm reduction can be applied to a lot of public health and even enforcement activities. You could talk about seatbelts and speed limits, and safer drinking limits, and getting people who ride motorbikes to wear crash helmets. Technically, that's all harm reduction, trying to reduce the risk of people's behaviours and the products that they use, like alcohol. But harm reduction is actually a lot more than just health and safety. And really, it has its roots in activism from marginalised and vulnerable groups from across the world. So these are two very good examples of this. I mean, this movement had its roots back in the 1980s when gay communities in America banded together to develop safer sex campaigns when they realised that the HIV/AIDS virus was devastating their communities. But fairly soon after, it was realised that people who inject drugs were similarly at risk from the same virus, and hence, particularly in the UK and in the Netherlands, there was a movement to introduce needle exchange, methadone maintenance and other sorts of opioid substitute therapies, and more recently, drug consumption rooms. The point is, so what is it that everyone in international tobacco harm control is actually, what they're trying to achieve here? So it doesn't matter really what your perspective or your views or your attitudes are, what we're actually trying to deal with, and what we're trying to deal with is the global smoking epidemic. And these are facts and figures which I'm sure will be familiar to anyone who's involved in tobacco control. So half of those people who smoke will probably die prematurely from a smoking-related disease. About 6 million people die every year from a smoking-related disease. Most of those deaths, about 70%, of the people will be in the low and middle income countries across Africa and Asia and the Middle East. And more people will die in this way than if you combine all the people who are going to die from malaria, HIV and tuberculosis. And the next two figures are WHO figures, who reckon that by the end of the century we're going to lose another 1 billion citizens to smoking-related diseases. And that's an annual cost of something like $1 trillion a year. So you can add that up between now and the end of the century, and you're looking at a phenomenal financial cost to the world. And what you're also looking at, bearing in mind this is all about city health, is a perfect storm between the growth in tobacco use, the growth in tobacco, smoking, and urbanisation. So at the moment, around 50% or 58% of the world's population live in cities, and that is projected to be up to nearly 70% in the coming years. And those cities that are called megacities, which have got more than 10 million people in them, they're also going to grow in number. We're going to have more and more megacities, more and more people crammed together in a limited space. Especially in places like India and China, and that picture kind of sort of encapsulates, you know, the bad situation we're in that case in terms of passive smoking and the impact not just on smokers themselves, but on bystanders, on families, and everyone in the community. So there is a challenge for tobacco harm reduction. And the single biggest fact here, and this is what gives the report its title, No Fire, No Smoke, is setting fire to tobacco is the most dangerous thing you can do. The cigarette is a lethal delivery system for tobacco. But the other thing is that people don't smoke to die, they smoke for the nicotine, but sadly, by lighting a cigarette, about half of them are going to die from the toxins that get released through that smoke. And that's particularly going to impact, like I say, on people in the poorest countries, but people in the West too, people who are homeless, people suffering from HIV and AIDS, as that poster says. It says, HIV alone didn't cause the clogged artery in my neck. Smoking with HIV did. And the other issue here is about people with mental health problems. Now in the UK, we're down to about 15%, give or take, adult smoking prevalence. If you look at the community of people who suffer mental health problems, you're looking at something more like 60 or 70% of people with those problems will also be smoking. And the same for people with drug and alcohol problems. So it's a major contributor to all the top WHO non-communicable diseases around respiratory disease and heart conditions. And the other issue is, of course, that while there is a lot of tobacco control initiatives going on around the world, it clearly isn't enough. Now, lots of people give up smoking by themselves. Lots of other people use nicotine replacement therapies, although they don't have really a very good track record of success. So although there is a lot going on in what I would call mainstream tobacco control, which is advertising bans, restricting sales to minors, not allowing public smoking, it clearly isn't enough, because even in the West, which has seen the steepest decline in smoking, those graphs are beginning to level out now. So there is a, if you like, hardcore is probably not the correct term, but there is a substantial body of people who, for whatever reason, can't give up nicotine and carry on smoking. And they're left really with a a kind of quit or die option if access to safer nicotine products is denied. So what is it kind of about these products? So like I said at the start, all the international independent evidence is piling up that these products are significantly safer than smoking cigarettes for people who really can't give up. And it does exactly what it says up there. It allows people to carry on smoking, but they are significantly less at risk from all the diseases that come from that. Now there is one product called Swedish snus, which has actually been around for 200 years. It's not brand new like e-cigarettes and heat not burn, but there is a proof of concept for tobacco harm reduction in the sense that, as you can see there in Sweden, mortality, because snus is allowed in Sweden but not anywhere else in the EU, they've managed to reduce their tobacco-related mortality to some of the lowest figures in Europe. And it has been estimated by Swedish health experts that we could have seen a significant saving in the number of deaths in the EU from smoking if there wasn't an EU-wide ban on snus. And in Norway, there's been a significant fall in the amount of cigarette smoking by women, down to about 1%, which I think is almost a world record, if not a world record. But there are still around 14 to 15% of women in Norway who use snus. So this is what is kind of a proof of concept, that you can reduce mortality, reduce smoking rates, even if people are still consuming a tobacco-based product like snus. And what's interesting about this is that, by and large, all of this has happened because of consumer activism and consumer interest in the products that go back to the earliest days of e-cigarettes and very much mirrors what happened in the gay community and amongst drug user activists, because they took it upon themselves to start accessing these products, to exchange information with each other about these products, well before there was any major commercial interest in these. And certainly without any encouragement from public health in general, and in fact, as we've seen in recent years, more like public health hostility to these products. So there is a big challenge here though, because if safer nicotine products were kind of lined up in mainstream tobacco harm reduction, if they were lined up alongside smoking bans and ad bans and restrictions of sales to minors and all of the things that we know are done within international tobacco control, if safer nicotine products were accepted in the same light as all these other interventions, I probably wouldn't be standing here, I probably wouldn't have been writing this report, because it would have been accepted by WHO and other international organisations as part of a legitimate exercise in trying to reduce the toll from the global epidemic of smoking. But sadly, that isn't the case. There's a lot of public confusion and political confusion about the safety of these products. There's a lot of flawed science out there that is not testing these products in real-world situations. There was a recent example, and I'm not exaggerating here, injecting a mouse with nicotine for about 24 hours and then claiming that this means e-cigarettes are bad for you. Now that's not an exaggeration, but it's clearly got nothing to do with the way e-cigarettes are used by the general public. There's a lot of misleading information put out by anti-tobacco harm reduction groups and governments. A lot of scaremongering media reporting, because obviously media like bad news stories, they like the scary stuff. And a report that says, say from Public Health England or from the Royal College of Physicians in the UK, that these are relatively safe products that people should be encouraged to use, does not make headlines. You know, tell someone that they're going to suffer a heart attack or a stroke if they use a heat not burn product. You can imagine that's much more attractive for the popular press. And to be fair, and to be brutally honest, there is a lack of leadership from those organisations like the WHO who should be taking a lead in these kinds of issues. But it really all comes back to human rights and civil liberties. And it comes back to people being empowered to be able to take control of their own lives and their own health in a way that's acceptable to them. In the same way that we just heard about the naloxone research about what suits the consumer, what suits the user. And this is no different. There are any number of international treaties and conventions on the right to health. And this is a statement that kind of encapsulates all of that. But it seems like a right to health with caveats in it. You know, if you're a marginalised and vulnerable group, somehow that doesn't seem to count. But the sting in the tail, the killer quote really, or the killer point, is that tobacco harm reduction, the international way of doing it with all the bans and policies and stuff, costs governments money. It costs to implement tobacco control. But if we could ease up on the regulation and allow people to have access, we could see a significant reduction in the toll from this global smoking epidemic, and it won't cost government any money at all. So, this report will be out in a couple of weeks' time. It's being launched in Geneva. You'll be able to get at it from the new website, and there's a summary document in all of those languages, and apparently quite a few more now as well. So I do hope you'll go and have a look at it, have a read of it, and read the report, read all the references. There's a lot of it, but even if you just read the summary report, and then make your own independent mind up about what you think about safer nicotine products and tobacco harm reduction. Thank you very much.